Today we're going to talk about sciatica. That's when we're feeling pain going from our low back down the back of our leg, usually described as numbness, tingling, burning, anything along those lines, in a matter that can go anywhere from just our hamstring down to our knee, down to our ankle, or even down into our foot. Now, what does this mean and what is it? So, sciatica itself is just the name of the nerve that runs down the leg. Now, when there's compression to that nerve, it can be at one of several spots, starting from either the low back, down into the glute, or other tissue that run over that nerve along the back of the leg and into the low back. So that name sciatica is the compression of the nerve, and that is why we're having those symptoms down the leg. There are some things that we can do to try to help figure out what's causing this. Now, this might not be your specific condition without you seeing someone in person, seeing a physical therapist to help you actually diagnose the root cause of the injury. But today we're going to go over a couple things that can help you figure out exactly what is going on. So, how we're going to assess for this, we're going to try to do two different things. The first thing that we're going to do is check if I go into extension and extend through my low back, does that bring on my symptoms? Does that increase anything going down my leg? If it does, that could be a sign of some compression through our low back, and we want to work in the opposite direction of that and not increase our symptoms. When we're going into extension, we are closing down the spinal canals where those nerve roots come out. So there's most likely some compression along those segments of our spine that we need to address. Now, if when we bend forward and try to reach down and touch our toes while keeping our legs straight, if that increases your symptoms, that can mean that the disc in our low back, in between the segments of our spine, is pushing out and back onto that nerve. So then what we want to do that is the opposite direction of that to help manage those symptoms and start by relieving pressure off that nerve by helping move that disc back to where it needs to be. Now, there's two ways we can go about treating this depending upon your directional preference. Now, if you have pain going into extension, but you have relief bending forward, you have a flexion directional preference. And if you have the opposite, so if I have pain going forward, but relief going into extension, I have an extension-based directional preference. Based off these two things, that's going to guide the course of our treatment moving forward. Now we're going to go into some exercises to help show you what you need to do to help take relief or compression off that nerve that starts in our back and going down our leg, so you can help treating your sciatica.